Good afternoon and welcome everyone to this webinar, which is the Introduction to Clinical Pharmacology and Biomedical Sciences at St George's University of London, the UK's specialist healthcare university. My name is Lanisha and I'm the Events Officer at St George's, and I'm going to be the host for the event today. So during this event, you'll be able to hear and see all of the speakers, but we won't be able to hear or see you. The way that you guys will be able to communicate with us is via the chat box function, which should be on your screens. If you have any questions that you wish to send in throughout the whole course of this webinar, please do type them in the chat box, and we will endeavour to answer them by replying through the chat box or during the Q&A segment at the end of this webinar. So the format of this event will be a course presentation about clinical pharmacology, and then you will get to hear about life as a current student on that course from one of our current students. You will then hear about the biomedical sciences degree, and then you will hear from two current biomedical science students, one that is studying the bachelor's and one that is on the MSci. And then at the end, we will have a Q&A segment. So the questions that you guys sending throughout the course of this webinar, we will answer those through the chat box, but also during the live Q&A at the end. And also, if you typed in any questions when you registered, then we will endeavour to answer those as well during the Q&A segment. We might have some interactive polls during the course of this webinar, just in case we want to ask you any questions that we'd like a quick answer for. So if we do initiate any of those, we will let you know beforehand. If for whatever reason you cut out of this webinar, please do try and log back in. We will still continue. If you are unable to get back in, we will be recording this session, and a recording of this session will be sent to you tomorrow in a follow-up email. So you will be able to see the whole contents if you are unable to get back in. At the end of this webinar, there will be a survey that pops up on your screen. So I'd be very grateful if you would take out a few minutes to fill out the survey, just so we can get a bit of feedback so we can improve future events. Okay, well, thank you for listening to my introduction. And now I will introduce on our first speaker, Emma Baker. Hi, Emma. Thank you for joining us.
Hello, good afternoon. Thanks very much, Lanisha, and hello, everybody. Hopefully you can hear me clearly. My name's Emma Baker. I'm a Professor of Clinical Pharmacology at St George's, and I'm the course director of our BSc in Clinical Pharmacology, which is the UK's first BSc in this subject. In my talk, I'm going to explain what clinical pharmacology is and try and inspire you to study it. I'm going to explain what the course is like at St George's and finish with some course requirements and tips. Of course, there'll be loads of opportunities for questions, and I'll be followed by one of our course students. You'll be able to ask her things as well. So let's start with some definitions. Pharmacology comes from the Greek, pharmakos, meaning medicine or drug, and logos, meaning study. So pharmacology is the science or the study of drugs and their effect on living systems. So what's clinical pharmacology and how's that different? Well, it's the study of all aspects of drugs as they relate to humans. Let's just look at some careers involving drugs, and hopefully this will clear up some understandings about the differences between pharmacology and pharmacy in particular. At the top there, I've put some school leavers applying to go to university, deciding whether or not they want to go into science or healthcare. You can see on the left that pharmacology and clinical pharmacology are science disciplines, whereas medicine and pharmacy are healthcare disciplines. Pharmacologists study drugs in the lab. Clinical pharmacology study drugs in patients and develop new medicines for use in healthcare, whereas doctors prescribe medicines and pharmacists generally are involved in the procurement and dispensing of medicines, as well as in clinically facing jobs where they're treating patients. So if you want to be a pharmacist working in a high street pharmacist or a hospital, you need to do a specific pharmacy degree. And at St George's, in collaboration with Kingston University, we have a Masters of Pharmacy. But if you think you might be more interested in drug development and research and science, then clinical pharmacology might be the side of the subject that's there for you. There's going to be questions, I'm sure, about is this a potential route into graduate entry medicine, and I'll try and answer that later on. Clinical pharmacology and medicine are very closely twinned as subjects. Clinical pharmacologists, of course, can train to be doctors, and some doctors are clinical pharmacologists. But this degree will be training you in science. Let's see the next slide. Clinical pharmacologists are a skills shortage in the UK, and at this time in the pandemic, where potentially next year we're going to have 6 million people unemployed, it's really important to choose a degree that will give you good prospects in this difficult world. This is a statement by the Association of the British Pharmaceutical Industry, the industry, if you like, the group that looks after pharmaceutical companies. And they put out this statement saying that clinical pharmacologists are one of 4 scientists that save the world every day, and that the UK needs more of them. And our degree was set up in part in response to this skills gap. I'm going to show you through the eyes of the COVID pandemic why we need clinical pharmacology more than ever before. So clinical pharmacology is all about discovering and developing new medicines for use in healthcare. On the left of the slide, you can see a poorly person who's been attacked by a SARS-CoV coronavirus and has got COVID-19. So how do we get out of this pandemic? As we progress across the slides, the next slide shows some of the mechanisms involved in the illness of COVID. So pharmacology is partly about understanding the mechanisms of disease so that we can identify targets for drug treatment. On the right of the slide, we've progressed across to a molecule. So once we know what's wrong in a disease, we then have to find molecules that can hit the targets that we've discovered. And that's called drug discovery. We then go on to drug development. And you might have heard in the news today, for example, that the first Pfizer COVID vaccine was approved by the licensing bodies last night, so that we can now start rolling it out across the UK. That approval process is called licensing, and you can see it there on the slide. So how do we get to that process? Well, firstly, we've got to take the molecules that we've discovered and test them in something called preclinical studies in test tubes and in animals to find out if we do what we think they're going to do. We then, once we have a candidate drug, have to get it into people for the very first time. Imagine what that was like, being a volunteer in a COVID vaccine study. Perhaps you know someone who was the first person ever to receive that vaccine. That's really exciting, but also kind of scary, because what if it has side effects? So those first in human studies have to be really carefully designed so that we don't do harm. And you can see the tiny square with a few blue people in shows how few people get the drug to start with, while we make sure it's safe, and then we can roll it out to larger clinical trials. The 2 squares with orange people in them represent 2 groups of patients, one receiving a dummy drug called a placebo or a dummy vaccine, and the other receiving the new vaccine or drug that we've developed. And that's called a randomized placebo-controlled trial. And only when we've done that and we know that the drugs are safe and effective can we then go across the licensing line and get it into patients for use in healthcare. And they're now rolling out the Pfizer vaccine across the UK this week and next week. And the first people who will get it will be the healthcare workers and the people who are elderly and vulnerable. So hopefully you can understand that clinical pharmacology is all about discovering and developing new medicines for use in healthcare. So where could a degree in clinical pharmacology lead you? There's a whole range of entry-level jobs you could do straight after your degree, working in clinical trials units, working with data, working in a lab, working in regulation, whatever suits you. Some people could go into marketing or sales. But you could also go on to develop your career in a whole load of different ways. We've been running a careers series for our Year 2 students this year, and they've heard all about how they could do a master's or a PhD to develop their research skills and discovery skills. You could go and do a graduate apprenticeship at master's level that will allow you to work while you're doing further studying. And of course, this could be a graduate entry route to healthcare. We don't have a direct exit from our degree into medicine, but our students learn a whole range of clinical skills and all about a whole range of clinical syndromes and diseases and how drugs work, which would make them incredibly competitive for graduate entry medicine. But also they'll have a whole range of things that they can do, either to make some money before they go to med school or to work their way through med school, for example, working in a clinical trials unit. The aim of our BSc is to develop graduates ready for work or further study in drug development and research. And I want you to think about that work ready thing as I go through my talk. The first thing to really emphasize is that we designed this degree in response to a skills gap. And we were being told there was a skills gap by employers. So it's really important that we design the degree with employers to make sure that the graduates that come out of this degree are really ready to do what industry want them to do. So this slide shows how we held some symposia with industry, something called Delivering the Next Generation of Clinical Pharmacologists. Ikri might tell you later, but you can also see that we've had industry involvement in our courses, coming to speak at our careers, giving lectures on the course, being the dragons in a dragon's den where our students made the case for a drug in a big presentation forum. At the bottom right, you can see there's something called Careers Question Time, where our students are hosting people from industry and asking them about their careers. So employers have been heavily involved in our degree. What does it look like? Well, it's a 3-year degree, and you have the option to go out for a professional year between years 2 and 3 if you apply for and are successful in obtaining a position. If you like, the first 18 months of our course are sort of stuck together, and then the second 18 months. So when you arrive in the first semester of year 1, you'll be introduced to all the different modules that you'll study and start to learn some of the basic skills. Semester 2 in year 1 and also semester A in year 2 are, if you like, a 12-month course that take you through a whole range of topics. For the semester B in year 2, you spend the whole semester on research projects on work experience. And then in year 3, you can develop more advanced knowledge and skills and focus down on your area of interest and the potential where you're going to exit in your career. This slide encapsulates our 6 modules, and our modules run throughout the course of what we call the toothpaste curriculum. So they're a bit like stripes. They're not, you don't do one module and then you're finished. You study them all at the same time, and I'll show you how that's not too bad in a minute, hopefully. So to learn about pharmacology, first of all, you've got to understand science. Remember, I said you need to know all about the disease mechanisms. So we learn the fundamentals of science. Now, in our pharmacology degree, you learn the science as you need to know it, rather than all at the beginning. So some pharmacology degrees, you spend a year on the science before you get to the drugs. We study the 2 main pharmacology subjects of pharmacodynamics, which is all about how drugs work, and pharmacokinetics, which is all about how the body handles drugs, so how drugs are absorbed, distributed through your body, broken down by the liver, and excreted by the kidney. Our degree is very applied, so the bottom 3 modules are all about the application of knowledge. The blue square is drug development, all about those processes that we've seen in the COVID slides about how drugs are developed and brought into healthcare. And drugs in healthcare is all about how drugs are used to treat patients and cure disease. And we do have throughout our course, we get to meet people from healthcare, we get to go on healthcare visits, and we also get to meet patients. And then finally, data and statistics the clinical pharmacology is all about experiments. And when we're doing experiments, we generate data, and to make decisions and to learn more about pharmacology, we need to interpret the data. So you get to do that throughout the course, and you get to learn how to use Excel and SPSS and do data analysis, all ready for year 2, where you do your own project and analyze your own data, and then again in year 3, where you're interpreting research papers, for example. Our degree is very hands-on, and our stated aim is that you'll be ready for work when you leave the degree. So we spend a lot of time thinking about skills. So our students learn clinical skills, which we call clinical trial skills. So in the very first month, students do a practical called How to Tell if Someone's Alive, and they learn to take vital signs. Throughout the course, they do a range of other things like some mock clinical trials, they do life support, looking after a collapsed patient, etc. They learn laboratory skills, how to do an experiment, interpret it, evolve the experiment. They learn how to manage data. And you can see at the bottom there, that's our students in the Dragon's Den doing presentation skills. From the very first day they arrive, our students are doing a mini presentation, and they build that up. They have a presentation skills course. By the end of semester 1, they're standing up in their groups doing a presentation to a panel of dragons, including people from industry and the principal of the university. And you can see, I hope, how well they work together as teams. And this is something we really encourage in our course, a team of staff and students all working together to develop skills in clinical pharmacology. And our students collect evidence of their skills in a portfolio. The idea of that is that when they graduate, they have something to show to employers about what they can do. In happier times, we have a range of on-site teaching and learning methods, but we've learned a lot during COVID, and it's likely that this will continue to improve and evolve. So we do have on-site teaching this semester, and that has been the practicals, which have included coming in for laboratory and clinical practicals. This semester, everything else has been online because minimizing the risk of COVID and, of course, with the recent lockdown. And hopefully Ikari will tell you what that's been like. But we have a range of different things, from live lectures, where everybody can dial in on a platform like this, through to pre-purposed lectures which are already on our learning management system, which is called Canvas. And also we have activities such as quizzes and assignments and things for students to do themselves. And each week we have 2 small group sessions, something called the Hub, which is at the beginning of the week, which is student-led activities with a tutor, and drug-based learning at the end of the week, which is applying what you've learnt in the week to real-world scenarios. So you have quite a lot of contact with the course team, and your tutor for your Hub is your personal tutor. So you have somebody who knows you really well, who can help you out whenever you have any problems. I mentioned that it's a toothpaste curriculum, so we have the 6 main modules and skills and portfolio, and they all go along at the same time. So how is that not confusing? Or perhaps Ikari will tell you it is. So the key thing about our course is that it's very integrated, and we want our students to develop what we call a synoptic understanding, so they understand the whole picture rather than just learning everything in little silos and not being able to stick it together. So this is an example of how the modules integrate to all fit together. So you've learned this is something relating to aspirin, which happened over a 4-week period. So the students learn the underpinning science of how drugs move across lipid membranes and how ionization affects that. They then learn something called pharmacokinetics, which is all about how the body handles drugs. And here you can see aspirin being concentrated in the urine at a high pH. They design their own clinical study to test whether raising urinary pH increases aspirin secretion. They then did the assessment as a combined laboratory and clinical practical, and then the data in data and statistics, they interpreted it, drew graphs, and found out what the results were. So although there are these modules running alongside each other, they all fit together, and hopefully, Ikari, I hope will tell you it makes sense, but I haven't paid her to do that. Next slide, please. Our learning management system is Canvas, and we have each of our modules has its own page. Again, I'll leave Ikari to tell you what she thinks of our online stuff, but our course team have worked really, really hard to try and be innovative and interesting, and for it to be lots of different things. For example, podcasts of 10 to 20-minute lectures instead of one great big 45-minute one, as far as possible. Quizzes, etc. And you can see at the bottom a quote from Michelle Donnellan, who at the time was the UK government's Minister of State for Universities when the A-level fiasco was going on. and she pointed out in her article that our degree is using everything from podcast to interactive quizzes to tailor our program for students online. What we think will happen after the pandemic is that we'll end up with a hybrid. We'll keep some of the things that we really like from the online learning, and maybe, for example, those very early morning lectures will go because people will be able to do them pre-recorded without having to get out of bed too early. But we'll probably increase the mixture of live and on-site teaching because we don't want to lose that community feel, which is so important to our course. I thought our students are absolutely central to everything we do on our course. On average, a year size is 50, although we have a bigger year in our second year and a slightly smaller year in our first year. And the students are the most important thing, and we regularly survey them and find out what they like and adapt the course to suit them. And so I thought I'd let them have a few words. Again, Ikri will speak for herself, but I hope this sort of shows that the students like the breadth and variety of the course. They like the interactivity and all the different things they have to do, and it's fun, their independence. They like the fact that we have a Clin Pharm family and it's very friendly. They think that we have fast feedback. And I also thought I would add in some comments about what they think about the transitioning to online teaching and the mixture between on-site days and off-site days. But I'll let Ikri speak for herself. At the beginning, I said that the aim of our degree was to produce graduates ready for work or further study in drug development and research. Our Year 2 students are only still really 2/3 of the way through semester 3, but they're already work ready. So this slide shows our students trained up and ready to run the asymptomatic testing centre at St George's, which is a centre doing rapid tests for students to help them get home for Christmas. I'm incredibly proud of how our students stepped up in the pandemic and manned this station. They voted unanimously to help the centre. This meant that some of their course has been pushed into January. They've all learned how to use PPE to keep themselves safe in a COVID environment, how to process COVID samples, and how to organise themselves as a team, do their own rotas and team management, etc. And I actually think they're work ready already. I'd give all of them a job. But on the right, you can see here how they've set up their own training video, how they've set up their own Canvas page with all the resources that their teams need. And so I think a big ethos of our course is being work ready and being innovative to try and get the best opportunities for our students. And you can imagine how some of these students are just, if they want to do graduate entry medicine, they're going to walk in. However, I have to say that when I sit in a small group with my students and I say, you all want to do graduate entry medicine, don't you? What the students say is, when we came to this degree, it was maybe, but the longer the degrees go on, the more maybe it is. So I think what it's done for our students, some of whom did want to do medicine, is given them so many more options. So now that at least they're able to make an informed choice. And if they do want to do medicine, they aren't half ready to apply. So our students are work ready already, and the course can flex and innovate to make sure our students grab the best opportunities. So how do you get into this wonderful course? What are the entry requirements? You apply through UCAS, 15th of January application deadline. You can see there the institution and course code. Our grade requirements are ABB, including biology or chemistry, and 5 GCSEs at grade 6 or B. I would say that there is some flexibility. If what we really want on our course are students. We call our first year pioneers, students who have got a pioneering spirit, who are motivated by curiosity, who want to make the most of every opportunity. So if that's you and you think those grades are not quite you, then get in touch and we can discuss and see what's possible. We accept alternative qualifications, you can see there, and we're looking for people who are passionate, who are motivated by curiosity, who are going to be great team players, fun to work with, who are keen to take every opportunity and see where it takes them. I mentioned get in touch. My email address is there and it will come out with the talk. You can have a look, you can check it out a bit more. So I've put the web address of our university course page. There you'll find Pfizer and Tiga, who are two of our ambassadors who are on UniBuddy, and you can chat to them. You can check out our Twitter account, although it's just being taken over by students as I speak, so it won't be as boring as when I was running it. You can find Edgem, who's one of our students, as Clinical Farm, and read her blog on Instagram about what she's been doing in the course, or you can find me, and actually now most of our students, on LinkedIn. So I really hope that some of you might be interested, and really looking forward to your questions. Thank you for listening.
Thank you very much for that, Emma. I hope you guys got a real good insight into that course. And if you do have any remaining questions about that course, then please do pop them into the chat box, and we will endeavour to answer as much of them as we can today. So now I would like to invite our student life panelist, a current student from the course, Ikari, just to talk a bit about student life.
Hi.
Thank you for joining us.
Thank you. So just to introduce myself, hi, my name is Ikari, and I'm a second-year clinical pharmacology student. And I'll be talking about my student journey. So I initially applied for biomedical sciences at St. George's as my first choice. And I remember at that point in A-levels, all I knew is that I wanted to pursue research, but I didn't know anything else. And it was thanks to the lovely admissions team here at George's that I was offered clinical pharmacology. Initially, I was a bit nervous just because I didn't know what clinical pharmacology was. But after reading about it a bit more, particularly the module on drug development, which is my interest, I knew that it was the course for me, hence I applied, and here I am on my second year. So the course is mainly made up of lectures, which was previously in person, but now it's online. And it's a mix of asynchronous and live sessions, which does have its positive and negatives. Personally, for me, I feel that just because second year content is quite dense and challenging, asynchronous sessions has allowed me to catch up if I fell behind and just do the work in my own time. But a potential downside is that you can get distracted and you do have to manage your distractions, and it can feel a bit static, which we've managed to overcome a bit by having small breakout rooms of 3 or 4 students, so at least we can interact with each other. But I think the biggest takeaway is that the course team is works so hard to listen to our feedback about what works, what doesn't, and tries to take everything into account. And that's what has made online learning so successful as it is. We also have DBL live sessions, which is drug-based learning, where we just talk about scenarios and prompts based on learning that we did the previous week. I find this session really helpful because studying can get really monotonous, and it's a nice way to try to revise without actually feeling like you're doing revision. We also have practical sessions where we learn pipetting and creating concentration effect curves in year 1. So this is my favorite session just because my area of interest is research, and you can often socialize with your course mates, especially those who are commuters, in this session as well. We also have clinical skills where we learn to take vitals like temperature and blood pressure. And I find this session really fun just because one of you can role play as a clinician and the other will be the patient. And it's a nice change of pace as well. And last but not least, as seen by the picture in the middle, we had a special event in our first year called Dragon's Den, where each hub group, my hub group was assigned the type 2 diabetes drug, dapagliflozin, and we basically had to pitch it to a panel of judges, or dragons, which consisted of the principal, people from industry, as well as some members of the course team, and we had to argue why our drug should be the one that's funded. This was such a good learning experience for me. I learned how to collaborate with my tutorial group or hub group, and I got to know them really well. And I also got to learn a bit more about the members in industry. But obviously, university isn't all about the academics. The social aspect is equally as important. And here at George's, we have different societies, such as African Caribbean Society, or ASOC, Tamil Society, Islamic Society. There's so many, I can't possibly list them all. And if there's one that you want to start, you can just by talking to the student union. And it's such a good way to make friends. One of my biggest regrets of first year was that I didn't join a society just because I was part of the first cohort of clinical pharmacology. I didn't know what the workload was going to be like, so I played it safe. So if I could turn back time, I would have auditioned for the Diwali or tuning show just because it seemed like a lot of fun, and all of my friends who did it, they all had a blast. And the other main method of socializing is living at halls, which is an experience unique to university, as I personally made all of my friends in my first week of freshers, and I made friends with all of my flatmates, which is really important for me because I'm an international student and I traveled a really long way from home just to be here. So it was nice to have that support bubble around me. And all in all, St. George's is a small university, so you get to know people really easily, and everyone that I've encountered has been really friendly, and you can't help but feel like you're part of a close-knit community because you are. And all in all, I'm so glad that I chose to study at St. George's, and I'm even happier to have chosen to study clinical pharmacology, and I hope that I've inspired at least a few of you to do the same. Thank you.
Thank you very much for that insight, Ikari. Ikari will be joining us again towards the end of this webinar in our Q&A session. So if you do have any questions for her, please do type them in the chat box and she'll be able to answer them during that Q&A segment. Okay, thank you. So now you guys will have the opportunity to hear about our biomedical sciences course. So I will invite Dr. Yao to come up and talk to you all about that.
Hello, my name is Yao Ohini Obuakwa. I'm the admissions tutor for the biomedical science, and I'm a lecturer in biomedical science with special interest in hematology. So when you are applying for a course in a university, there are a few things that you would like to think about. That's, you want to look at the career opportunity of that course. You want to look at some of the facilities for students within that university. You also want to look at the course content and then satisfaction of current students. Today, you've got the opportunity that there are some current students that will speak to you about, tell you about their satisfaction and what the university or in St. George's offers. And then you also want to find out, why do I want to study in that specific university? As mentioned earlier on, St. George's is a UK specialist healthcare university. So what can I do with a degree in biomedical science? There are a lot of things that you can do with a degree in biomedical science. You can work in a pharmaceutical industry, biotechnology, clinical research, diagnostic laboratory, scientific research. You can even work in a law firm, intellectual property, grant funding, scientific publishing, name it. There are a lot of opportunities or a lot of areas that you can work with with a degree in biomedical science. And also, if you want to do further degree, you can study for the MSc Physician Associate Studies that we also offer in St. George's. You can do MRes or MSc. You can do a PhD, dentistry, and also do medicine. Now, in year 3 of the program, you can specialize in many areas, which include global health, anatomy, genomics, infection and immunity, medical ethics, and all these give you further career options. This is just an example of some of our alumni and their careers, where they ended up after their degree in biomedical science. We've seen Yasmin is now working as a clinical research senior site manager at Pharmaceutical Research Associate, which is health sciences. And Kai is also working as an auditor at KPMG, something that is completely different from biomedical science, but because of the transferable skills that he gained studying in St. George's, he's able to get a job with KPMG. And also, Fazia is also working as a review operations assistant at Frontiers Publishing. We've got also George, who is also working as working in Deloitte. And some of our students have also gone on to do further studies. Nathan is doing a PhD in St. George's, and Rosie is doing PhD in Washington University. This is a graduate outcome of graduates from St. George's Biomedical Science after 15 months of graduation. This is not something that was done by St. George's, the Department of Education that did this study, looking at all graduates 15 months after graduation. And the BSc from St. George's, 85% of the people that responded were either employed or on further studies. And some of them were doing studies, PhD, medicine, or MRes. Only 15% that are doing others, either they are traveling or they are not employed at the moment. With the MSci, all those who responded were either employed or were on further studies. Now, what do you need to get on the course, the biomedical science course in St. George's? You need A and 2Bs with chemistry and biology. So you need chemistry and biology, minimum of B in both of them. Now, we offer lower grades for students who come from schools that meet the adjusted criteria. And also, if you do a research, so if you do your A-level for 3 years, we also consider them. But we do not accept general studies. And then for the GCSE, you also need 5 GCSEs, which includes maths and English and double science, or biology and chemistry. That should be either 6 or B. For international baccalaureate, the overall score should be 34 with 16 points at higher level, with 6 in either biology or chemistry and 5 in the other subjects. And then also the standard level, a minimum of 5 in maths and English. We also do accept access to higher education diploma, where you have to have 60 credits, 45 of them should be graded and 15 are ungraded. Now the 45 graded, you should have 27 distinction and 18 should be in merit. Now, why is this one important? This is important because while you are studying in St. George's, most likely in your final year, you get an opportunity to use one of these facilities. You also have, in the final year, you have the opportunity to work in the lab when you are doing your final year project, working one-to-one with a supervisor, and then you get the opportunity to use some of these facilities. We are very concerned. We are very particular about this things because we believe firmly in research-led teaching. So it's very important that our students also do some research that will enhance their teaching. And then even in second year, students also work in the laboratory. First and second year, they work in pairs in the teaching laboratories. While studying in St. George's, the students will gain a lot of transferable skills and develop some of them as they go along, including communication skills, working in a team, management skills, problem solving, research and investigation. You also develop your planning and organizational skills, and you develop your leadership skills and also interpersonal skills. And of course, digital and literacy skills are also developed here. Now, as a biomedical science student, you can also enroll in the St. George's Skills and Recognition Award module. This will allow you to showcase your skills and gain an award for each that you can include on your CV. Now, I will want to talk to you a little bit about the course, the teaching and learning on the biomedical science course. The academic year is about 30 weeks divided into 2 semesters. And we estimate that students should be working for about 40 hours per week. Teaching contact time is approximately about 14 to 18 hours per week. That is in the normal circumstance. But now that we are not in normal times because of the COVID, a lot of our teachings are done online, but those teachings that need to be done on site, like practicals, are done on site, but most lectures and small group tutorials are done online. So you have a small group tutorials where 8 students with a tutor meet online, and then they go through a problem. They will be given a problem. This is called scenario-based learning. So you'll be given a scenario and then you work through that. You also be doing dissection. So that one also, students have to come on site because that one cannot be done online. So sometimes students have to come on site. And then the practical classes, the students also come on site for the first 2 years. And also even in the third year, final year students are all working on site doing their research projects. So for the first 2 years, the course content, the main core subject areas for the first 2 years include anatomy, cell and molecular biology, genetics, immunology, pharmacology, pathology, and physiology. You also be doing anatomy dissection where students will be using cadaver to study the parts of the body. You also will be studying research methods and laboratory techniques. And in the second year, you go on to study molecular basis of disease, which includes cellular pathology, chemical biochemistry, and hematology. And also you'll be doing infection and immunity, clinical genetics, and you'll be doing some study skills, learning strategies, and also how to do calculation, data handling, and then also communication and writing skills in the first 2 years. So let's look at the detailed content of the course, biomedical course. The first semester, you do 4 fundamental modules. That's the fundamentals of living cell, where you study the introduction to cellular and molecular biology, which underpins the scientific study of scientific basis of diseases. You also be studying fundamentals of pathology, fundamentals of pharmacology and physiology, and then you do personal and academic skills. This involves how to help you in your writing skills, your communication skills, and also calculations and numeracy. And in semester 2, you start with physiology 1 and anatomy 1, and you continue with the personal and academic skills. In second year, you do genomics, which is genetics, biotechnologies. You also do physiology 2, you do anatomy 2, and you also continue with the personal and academic skills. It's very important to develop your skills. So for the first 2 years, you'll be doing all this, you'll be doing these personal and academic skills that involves your communication, how your writing skills, interpersonal skills, data handling, data analysis. Now semester 4, you do the molecular basis of diseases, which include hematology, cellular pathology, and also clinical biochemistry. And then you will also be doing microbiology and immunology, which includes infection and immunity. And then again, you continue to do your personal and academic skills in semester 4. Now, when you come to third year, year 3, the modules there are a lot of options for you to choose from. There are 15 credit modules and 18 30 credit modules for you to choose from. So you normally choose 2 30 credit modules and then 1 15 credit module. So for the 15 credit module, there are a lot of them. I don't want to go through all of them, but behavioral medicine, global governance for health, and also culture and mental health. And then the 30 credit modules, biology of cancer, cell and molecular biology, conflict and catastrophe of medicine, image of anatomy, and a whole lot of them. And also you have clinical anatomy, clinical communication, and professional skills in health care. So there are a lot of choices to make from. So your final year is up to you to choose a pathway. There are 10 pathways that you can choose from. And in these 10 pathways, what you are choosing is that you need to have 2 30 credits modules and 1 15 credit module. So your third module should be 75 credits. And then you do a research project, of which constitute 45 credits for your final year. So it's up to you to decide which pathway that you would like to choose when you come to the third year. Now, these are some of the pathways that you can choose from. So very small, I cannot go through all of them, but it includes anatomy, cellular and molecular biology. So if you choose the pathway, there are specific modules that you have to do. For the anatomy, for example, you do development and diseases, developmental diseases, and the image of anatomy. So depending on which pathway that you want to choose, there are specific modules that you have to do under that pathway, but each pathway should include 2 30-credit modules and 1 15-credit modules, but total thought module should be 75 credits. And then you have also your research project, which comes with it, that is 45 credits. That is for the BSc. Now, if you are doing the MSci, then in your final year, you also do research modules, which is 105 credits. Now, these are some of the research project modules that you can also choose from. So apart from the thought module, which is 75 credits, research also where students have the opportunity to work one-to-one with an academic in the laboratory. You can either do your research project in any of these modules, which include anatomy, development, and cell biology, behavioral medicine, biochemistry and molecular biology, clinical neuroscience, clinical science. You can also do your project in psychiatry, pharmacology, infection and immunity, global health, medical ethics, and law and humanities. And also you can also have structured research project. Now, the structured research project is a special smaller project which is only 15 credit. That is specifically for students who maybe want to go and do medicine and they do a different or specific pathway. I'll talk about that later. Now, with the MSci in biomedical science is a continuous integrated 4-year program with research skills modules, and it's an extensive research project, which I mentioned that you have 105 credits as compared to the BSc, which is 45 credits. So this one is targeted to students who are interested in science and research, and they gain greater practical and research skills than those who do the 3-year biomedical science. And this is give them more competitiveness for PhD study or research posts in academia, pharmaceutical industry, or bioscience industry. Now, this MSci degree is eligible for 4 years of students' loan. And you also have the Erasmus scheme that gives students the opportunity for the final year in an European institute where you can go and do your final year project in an European institute, particularly in Spain or in the Netherlands. Now, the MSci is the only MSci in London. The St. George's MSci is the only one in London. So let's look at this, how it works if you want to do the MSci. If you start first year that you want to do the MSci. Now, for the first 2 years of your degree, the BSc students and MSci students are doing the same thing. So at the end of the second year, even though you've registered to do the MSci from first year, at the end of the second year, you should achieve an average score or mark of over 60%. Now, if you don't get 60%, then you'll be asked to go and do the BSc. Alternatively, if you register for 3-year BSc from the beginning, and in second year you change your mind that you want to do the MSci along the line, you can also cross over to go and do the MSci. But that means you also have to achieve 60% or above at the end of second year. and then you can go and do the MSci. So you can start with MSci from first year, or start with BSc and then go on to do MSci when you come up to second year. Alternatively, if you start with MSci and you are not able to achieve the minimum mark, then you have to go and do a BSc. For the BSc, you go do 75 module credit in your third year, and then 45 module credit for your research project. And then with the MSci, your final year, the fourth year, you do 105 credit research project. Now, I think some of you may be asking this question: can I go on to do medicine if I do biomedical science? The answer is yes, but we want students who are coming to biomedical science to be able to stay in research. Hopefully, they will enjoy the course and stay on. Now, the students, about 30% of our students also go on to study medicine, and there are 3 routes. For St. George's course only. The first one is for St. George's course only, where the students can go direct into T year of the 4-year MBBS 4. That is the 4-year medical course in St. George's after finishing. So what happens is that if you want to go on to the transfer, then for the first 2 years, you have to have an average mark of 66% and above. 66% or above at the end of second year. If you get 66% or above, then you can apply to go and on the transfer, and then you'll be called for an interview. So all students that get 66% and above and want to do medicine apply for it, and they are called for an interview. So it is only at the interview then the students will be graded or in order of merit. So the top 25 students will be taken, and then they will go on to study medicine after they have graduated with a BSc 2-1 in their final degree. So you want to do medicine, although at the end of second year, you'll be called for interview. When you get if you pass the interview, you'll be given a conditional offer. The conditional offer is that you have to graduate with a minimum of 2-1 to be able to go on to the T year or the second year of the 4-year MBBS. So that will take you another 3 years, and in total to be 6 years in St. George's. So if you come to St. George's for the biomedical science degree, there's a flexible degree structure. So for the BSc, you can graduate with BSc Biomedical Science with anatomy, with global health, with pharmacology and physiology, with psychiatry, with medical ethics, and a whole lot of, so there were 10 pathways, or with biomedical, and then the other one, if you want to do medicine, for instance, if you get 66%, those who get 66%, and then are called for the interview, the 25 students that are going to be transferred to the MBBS 4, they go to the third year, and then they will do what they call clinical bioscience pathway. And with that 25 students, there will be another 35 students who also may want to do medicine, but can't do medicine, maybe somewhere in another institute, or even in St. George's, but not the transfer, but the 4-year JEP or graduate entry program. Those students will do go on a special pathway called the clinical bioscience pathway, where they will study 30 credits of clinical anatomy, 30 credits of clinical communication and professional skills, and they will also do a research project. And as I mentioned earlier on, the research project is called structured research project. So it's a smaller credit, it's 15 credits, compared to students who are doing biomedical science or students who want to stay in science, they do 45 credits research project. So you can graduate with other BSc biomedical science with clinical bioscience, or you can also go on to if you are doing the MSci in biomedical science. So there's a flexibility of degree if you come to St. George's. Now, the other pathway or the other route to become a doctor is also going through the graduate entry course, where many universities offer those courses. And that means you do another 4 years after your graduation, and then that will be a total of 7 years. You can also apply for a non-graduate medical course at many universities. So the traditional one, that a 5-year MBBS, that means you do 3 years biomedical science and then 5 years in medicine. That will give you a total of 8 years. Now, with St. George's Biomedical Science, we have what we call professional training year. Now, what is professional training year, or what is PTY? This is an optional but integrated part of the degree. Students spend 11 to 12 months gaining experience in a professional or industrial area which is relevant to biomedical science. They can also spend 7 to 8 months in an Erasmus scheme. We have 7 to 8 months for an unpaid placement. Sometimes some of the students get their placement where they still get paid for. This professional training year only takes place between the second and the final year, or after second year of your course. So the aim of the PTY is to enhance the student's employability upon graduation, and it's also to prepare you for the world of work beyond university. The PTY also enables you to develop your key employability skills that employers are looking for, that will equip you to the changing demands in the workplace. It also enables the student to mature through personal and professional development and to evaluate your placement experiences. And most importantly, not least but not the least, last but not the least, is also to enhance your CV. Now, the PTY courses are faring better than full-time course. Unsurprisingly, sandwich courses students significantly out-earn other modes of study. With a year in industry, these students enter graduate market with more work experience and more contact than their counterparts. So they tend to earn more. So students who have done PTY, because of their experience, they earn better than their counterparts who have not done any PTY. This information is a source from the Department for Education, longitudinal educational outcome, that students who do professional training year enter the employment market with higher earnings, and we've got, because they have much more experience, and also they've got contacts whilst working in 1 year during their professional training year. Within St. George's, the process for the professional training year is that pre-placement. For the first 2 years, we help you prepare your CV, and then we also help you in your application, and also help you in your interviews, and also getting a place. So the university finds the place, but we find the places for the students who want to go and do the PTY. Normally there are a lot of places for the students than the number of students that even apply for. Okay, so the first 2 years is to help you prepare your CV application and then an interview. Then when you get the offer, you go after your second year. So your third year, you'll be at your placement. And at the placement, when you are at your professional training year, you get reduced fee for the PTY year. And whilst you are in the placement, academic will visit you, and they will also assess you, ensuring that you are gaining experience, you are gaining useful skills whilst you are doing your placement. And then when you have finished the placement, you will be expected to submit a final report on when you come back. That's on your 4th year. So on your 4th year, you come to finish your degree. That's at the 4th year, you come and do your 75 credit module for thought modules, and then also 45 credit research module, plus your professional training year final report. And from the professional training year, you'll be given a certificate of professional training year, which is issued by St. George's. So at the end of it, you go to graduate, or if you want to go further to do MSci, you can go on further to do the MSci. Now, there are potential professional training year places, which include GSK, AstraZeneca, Johnson & Johnson's, and MSD, Pfizer, in some Public Health England, in St. George's, NHS, and also Great Ormond Street. There are a lot of places that are available for students to choose from to apply. Or you can go for the Erasmus scheme at the Radboud University in the Netherlands, the Granada University in Spain, and also University of Barcelona, where you can earn up to about 450 euros per month. Now, just to give you a brief overview of the placement past students who went on placement, the professional training year placement. The first cohort was 2018-2019. We had 10 students. Some went to Pfizer, some went to Congenica, some worked at KCL, SGL, or University College of London. Second cohort, we have 14 students, some going to GSK, some switched precision diagnostic, some working or doing their placement in St. George's or Great Ormond Street Hospital, and some also went on the Erasmus scheme. Now, this is the third cohort. That is this year, the third cohort. There are 7 students. Some are going to do their placement at University College of London. There's 1 student also working at GSK. And then a couple of the students are working here in St. George's at different departments. So it's very important. I'm just showing you this one. This is one of our students who went on a professional training year. And then for the work that he did in the 1 year, this student was able to get a publication out of it. Not only 1 publication, but she was able to publish 2 papers from the work that she did. There was another student also who also went to do PTY in another institute and was also able to get a publication from her work. This student, the other students that I was talking about, she did a professional training year in Spain, and she was able to get a publication out of her research project. So just to give you the highlight that St. George is a unique bioscience course. The course in St. George's is a unique one. As we mentioned earlier, it's a specialist healthcare university, and also there's a flexibility, and you can focus in the 3rd year to choose a pathway that you like. There's also an intensive final year research project with professional research groups, and you work also closely. The university work closely with one of UK's busiest hospitals. So some of our teaching staff are clinical staff, and there's also an opportunity for you to get some work experience in an NHS laboratory. There's also learning and development integrated with the curriculum. So you develop your skills weekly with small group tutorials and also working in the lab with some of your students. And also there's this Erasmus scheme that gives you opportunity in your final year of your MSci working at an European institute. There are also career advice and support, which is embedded into the teaching of the biomedical science course in St. George's. So we support our students even about the career that they want to choose. There's also opportunity to gain professional experience, as I mentioned, the professional training year, which enhances your employability. So many students, of course, some of them go on to do further studies, PhD, or doing MSc, or going on to do medicine. Thank you for your attention. I will be available for any question, but now we'll wait for the student to also give you their side of the story, how they find life in St. George's.
Thank you very much, Dr. Yao. That was very insightful. As I said before, if you have any questions leading on from this talk, then please do post them in the chat box and we will answer them during the Q&A segment. So I will now invite on our current biomedical science students to talk to you a bit about life as a student at St. George's on the course. Hi, Dania. Thank you for joining us. I'll hand over to you now.
Hi everybody, my name is Dania. I'm a final year student on the biomedical science course at St. George's. As you heard Dr. Yao before, in final year you can specialize, and I'm specializing in neuroscience, psychology, and psychiatry, if that's anybody who's interested in that. So yeah, George's is quite a unique university. It's a really small place, so it has that sort of community feel when you first start. It is quite scary doing uni for the first time, especially if you're not from London. I'm not from London. I came here from Glasgow, so obviously it was very new to me. Everybody was very different. I didn't know anybody. It was all a new experience, but you'll get settled in real quick. I think the biggest thing about uni is that there's a lot of content, especially for biomedical science. It's quite an intense course. There were lectures, especially in year 1 and year 2, about 4 to 5 days a week. There'd be lectures. So you have to do a lot of note taking and paying attention in lectures, making sure you have all that information down. But the good thing about George's is that we also have different sort of things as well. It's tutorials where you sit, and it's case-based learning. So you sit with about 10, 15 other students in a room, and you sort of discuss a patient case, and you talk through the issues, and the case will always relate to what you're learning in that week. So that's quite, it helps to consolidate your learning from the week's lectures, and that'll be in year 1 and year 2, you'll have those. You also get to do a lot of lab work. So along with the stuff that you learn in year 1 and year 2, you're also going to be doing experiments, stuff like pipetting, gel electrophoresis, learning how to do these laboratory techniques that are going to help you ultimately in a career in research or medicine, especially in final year where you do a research project, which could be lab-based or it could be literature-based. As well as this, you also get to do dissection room sessions, which is pretty cool. You get to go to the dissection room at George's, and you are able to learn from a prosection where the demonstrator will show you an actual cadaver, and you'll be able to observe and be able to touch and see different things in the cadaver that's already been dissected for you. So that's a really good way to learn, and that's also where your OSCE exams are going to be, where you get to go into the dissection room and sort of take an exam on the different parts of anatomy you've learned throughout the year. So that's the sort of academic side of biomedical science. Besides that, George's is great for its community because there's lots of societies on campus, and even in lockdown, there's lots of opportunities to get involved. I put in the middle here a poster of the big Intersoc Diversity Quiz, which was something that my society, Literature Society, was a part of, as well as Film, Anime, TV Society, Oncology Society, Athena Swan, which do amazing stuff for diversity and inclusion in healthcare and science. So there's lots of different types of things that you can get involved in, and as you can see, these societies aren't always academic. They're not all science or medical based. There's different things. Niche interests as art society as well. There's also lots of sports and other sorts of teams that you can get involved. One of my friends does cheerleading. So there's loads of different things that you can get involved with, and I really encourage it because it helps you get to know a lot of people, especially if you're brand new to the area, you're brand new to Tooting, you don't know anybody at uni. It's a good way to get involved and meet people and sort of get comfortable with where you're at university. So I really encourage you to get involved in that. As well as that, there's I've also put a little picture at the bottom there of the society that I'm involved in, Art Society, where there was a trip to the Tate Modern. So there's fun opportunities like that to get involved in if you take part and you get to meet people. The good thing is that everybody's really friendly, especially older years. Always, it's a good way to network as well. Societies, you get to get notes from older years, advice from them, meet people outside your course, which is going to be, you know, so interesting. You get to meet people who do different courses like paramedic science or medicine or physiotherapy, radiography. So it's really good to sort of branch out and meet different people, and you get to sort of get along with people from different sides because you're going to be working with them in the healthcare environment anyways. And also at the top, I just want to put like a little message that, you know, university is tough. Biomedical sciences is a tough degree. I'm in my third year. It's, you know, there's a lot of work to do. I have to do my research project at the same time I'm doing my lectures and other things, but you still get to make time for your social commitments, your work commitments, your personal commitments. And it's a lot, but university is there to support you as well as the Students' Union, which is a union that's put together to sort of look after the student perspective and side of things. They sort of look after societies as well. The university does have a counselling service, and there are, you know, people you can talk to and helplines available if you do have, you know, trouble with university and stuff. It's a tough thing to go into straight from high school, but there's always going to be support available, and Georges do their best to make sure that that support is available for you. And, you know, societies and students, and my job as a president of society is to look after everybody that I'm responsible for. So those are different things that you can get involved with, and I really hope you are excited to start at Georges if you're thinking about it. Yeah.
Thank you so much, Dania. That was really insightful. Now I'd like to invite on the screen Jennifer. Hi, Jennifer.
Hello.
Thank you.
All right, so hi guys, my name's Jennifer. I'm in my 4th year of biomedical science and I'm studying the MSci course. So a lot of things have already been mentioned, and I've just kind of split my slide, which is on the screen now, into the course itself and then everything else to do with student life. So the course itself is mainly content-based, and you'll literally learn everything from head to toe about the human body, but lab work is an important aspect of the course as well. And there's lots of interesting practicals, such as analysing samples of tissues, fluids from both patients and animals, etc., etc. And these really help to bring to life the content that we're learning through our lectures, and help us to apply our knowledge to real-life medical issues. So the first picture on the left there is actually a picture I took down the microscope of a mouse ovary. And this was part of our physiology module. Physiology is a huge part of biomedical science, and it is one of the 10 specialties that you can specialise in your 3rd year of your degree. But what I specialised in my 3rd year is infection and immunity. And now that I'm in my 4th year and I'm doing my research project, I'm looking at the coronavirus and how it affects the immune system, which I'm really enjoying at the moment and looking forward to the resulting conclusion and dissertation that I'll have at the end. So the next picture I have on there is a picture of me, and I'm teaching a school student how to perform basic life support and emergency first aid. So even though I'm not a healthcare student, I've been able to learn basic life support through various societies and also by working as a student ambassador, which is actually a fantastic opportunity for students to get involved with the university. You can get involved with outreach, with planning and event management and student recruitment, all sorts of teaching opportunities, etc. And this is something that I think is quite unique to St. George's in comparison to other universities, from what I've heard, that students can really get involved with the university. The next picture is taken last year, and that is around half of my biomed cohort year group, and we're sitting in one of our smaller lecture theatres. I'm splat bang in the middle. You can probably play Where's Wally with that. And in my cohort, there were around 250 students, and in general, we sit together for the first 2 years of our classes. And then in our 3rd year, when we specialise, we split up into our various specialties into smaller groups. So just wanted to show you how it looks inside the university in a lecture theatre. Most of these people have now graduated, as most of them did the BSc. I do miss them a lot, but I think that's one of the greatest things about the university. It's already been mentioned, but everyone knows everyone. There's a great community feel within the university, and I've always felt welcomed and included and appreciated. So there's a lot of outreach going on during the lockdown, as Dania has already mentioned, to ensure that people are included, they're not left out, not isolated during this pandemic. So I've recently joined about 3 different societies. One of them is Art Society, and we just had a Ghibli themed month, and that was one of the paintings at the bottom there that I managed to do for that month, the Ghibli themed month. And I've been part of many different types of cultural societies, medical, scientific societies, dance society, film, movie society, lots of different societies. They were all a blast. Had a great time with all of them. It was a great time to wind down and relax and just enjoy myself. And actually tonight I will be attending a games night, a virtual games night, playing a bit of Among Us and some other games as well. And the last picture I took there is actually a picture of my amazing ice cream in Chinatown. Now, why have I got a picture of Chinatown? Well, I just wanted to highlight the location of the university. So the university is in Tooting. It is directly attached to the hospital, St. George's University. Fun fact, the show 24 Hours A&E is filmed in St. George's Hospital, and it's only 3 minutes away from the Northern Line tube station. So it's incredibly accessible location. It's not far from central London at all and other great hotspots. And I'm a commuter, which is really useful to have a good network to get there. So the location for me has given me a lot of opportunities to explore London and have lots of great days out with my friends as well. So that's all I can say in 5 minutes. I've had a really great time at this university, and there's just countless opportunities, things for you to get stuck in with, things for you to learn, etc., etc. Thanks for listening.
Thank you so much for that, Jennifer. I hope you guys enjoyed hearing from our current students. Okay, so we're gonna go into our Q&A segment now. So if I could ask for all staff and students to come back on screen. Thank you. Yes. Right, just before we start, I have a quick poll that I want to initiate. You guys will see it pop up on your screen. And I just wanted to find out, basically, if some of you found out about this event from one of the clinical pharmacology or biomedical science flyers that went out not too long ago. I just wanted to see how far and wide that flyer went and how many of you basically signed up as a result of seeing that flyer. So I'm just going to give you guys a few seconds, just pop yes or no into, just choose yes or no as your answer for that. For me, that would be great. All right, just going to give it a couple more seconds. Okay, I'm going to stop that right there. Thank you so much to those of you that answered that. Thank you very much. And another thing I just want to add, just before we start the Q&A, is that tomorrow you will all be getting a follow-up email, just like thanking you for joining the webinar with a link to the survey if you don't fill it out at the end of this webinar today. But also in that email, you'll have some information about some taster lectures that we will be offering as of next week and until January. Taster lectures that give you an insight into clinical pharmacology and also biomedical science. So if you would like to join any of those taster lectures, then there's a link in that email so that you can sign up and join. So please do look out for that email tomorrow. And if you would like to attend one of our taster lectures, they're free online virtual taster lectures, then please do follow the registration instructions in your emails. Okay. Right, let's get to some of these questions. There were loads of questions that were sent through during the course of this webinar. Some of those I know have already been responded to. So let's just start with these ones here. So I know you covered this a bit in your talk, Emma, but I was just wondering if you could clarify what jobs people could get into if they successfully graduate from clinical pharmacology. Sorry, Emma, you're still on mute.
Schoolgirl error. When you finish your degree, you have lots of options, and we've been working very closely with our students with a career series. So the first thing is that you will be able to go straight into a job. So the sorts of places you might be able to work is in a clinical trials unit, and there are loads of those throughout the NHS. Maybe working with patients as a clinical trial practitioner, or working in a lab, or working with data, or something called governance, research governance. You could potentially go into a graduate entry post in a pharmaceutical company, or work with something called a contract research organization, which is a company that delivers research. And there are a whole range of different biotechs and other types of companies that will take people as graduates. Of course, you could do other things, but those are some of the main places you might start. The other thing about a clin pharm degree is that the job you start in is probably not going to be the job you end up in. And so there are also some jobs you can do in industry that are called master's level apprenticeships. So you work and you do your master's, so you get paid while you're doing your master's. Some people, so students in our degree have been looking at all different options, and we've only got to year 2, so we haven't seen what happens yet to our 3rd year because it's a completely new course. But students have been looking at a whole range of things. So some are interested in research and might do a master's or PhD straight from uni. Some people are interested in working. I know somebody who's applied to work as a data manager for a professional year. Some people have applied to go and work in industry for professional year. Of course, some people might want to go into healthcare. And again, we don't have a transfer from clin pharm to medicine, but not only can you get a great degree, learn loads of great skills doing clinical pharmacology, but you'll then be able to work, for example, whilst you're doing a graduate degree. Those are sort of some of the things you can do from this degree. But we'll see, once Ikri and her colleagues graduate, we'll see them probably running the country quite soon, I think.
Thank you very much for that, Emma. And then a question for the students. I'm not sure if any of you guys can apply, but the question is, do any of you students have any personal experience applying for the Transfer to Medicine program? And if so, what was that like?
I can answer this one.
Okay, thank you, Dania.
Yeah, so I managed to get the interview for the transfer program this year. I didn't get it, but I think but a couple of my friends did, and I think I have a little bit of authority. What I'd say is, don't focus too much on your grades, because if you work hard, grades are going to come with that. But the main thing you need is to pass the interview. That's the biggest hurdle that's stopping you from getting that transfer. So I think work on your interview skills, work on building up work experience, and not just healthcare related stuff, but just a part-time job, anything that you can sort of relate to transferable skills to medicine. If you can talk about stuff in an interview, that's going to make you look a lot, better as a candidate. It doesn't have to be specific hospital things. I think my mistake was perhaps not, talking about the experiences that I had enough. So if you have any sort of experience, regardless of what it is, I think make a note of it, write down what you learned, write down what that shows as a doctor, like what skills are that, how that's important, and research the NHS. Those stuff that I probably missed, and things that you should probably start looking at from the beginning. But don't think that grades are the most important thing. It's probably your enthusiasm and your drive for the subject of medicine than anything else, I think.
Okay, great, thank you. A question for you, Dr. Yao. Is the biomedical science degree program accredited by a professional institution?
Okay, currently the biomedical science degree in St. George's now is not accredited. The reason being that we were previously accredited, but we realized that for the past 20 years, only 2 students have gone on to work in a hospital lab, in a laboratory. So we felt that it was not necessary to get accreditation, so this course can be changed. So we have changed the course a lot. That is why we got those different modules or different pathways that allow students that option to make their own choices. And then when you finish, those students who want to do maybe work in a lab, hospital laboratory pathology lab, they can go on to do maybe about, I think, a short course to be able to get that accreditation.
Thank you. Thank you very much. There's a few questions which I'm going to quickly just fire out the answers to, because they're very simple ones that don't need a lot of detail. So a few people have asked them which course is better to apply for to get into medicine and things. And you can apply for either course, as was detailed in the presentations. But the biomedical science course obviously has the internal transfer route. So that would be a good course to apply for if you'd like to try the internal transfer route. Just do remember that all of our courses lead you on to specific careers as well. So although you can apply for graduate entry medicine with any degree at St. George's, you know, just think about the great career opportunities that you will have if you were to study, let's say, clinical pharmacology. They do set you up for great careers and are not just entrance routes to medicine.
Could I come in on that,
Emma?
Yes. Just briefly?
Sure.
I would just say to the people listening is that, and I'd like the students to comment as well, is that whatever you do for your degree at university, try and do that because you want to do that degree, to enjoy the experience and get the most out of it, not because you're trying to get somewhere. You've got to enjoy the journey, otherwise you're going to be miserable, because you may not be successful. Even if you do biomed science or clin pharm and you think you want to do medicine, I don't know what the transfer rate is but it's 1 in 25 people out of 250. So this is not, it is a way to get into medicine, but do it because you are going to enjoy the journey and learn loads of things and make friends and have a fantastic experience, not just because you're just waiting till one day you're going to get into medicine. That would just be my honest, truthful advice for you. What do other people think? Can I ask the students what they think?
Yeah, I think I just want to add to what Emma said. It's true that you want to try to enjoy your course, because I've come across a student who wanted to do medicine and then she came on to biomedical science, and I think she wasn't enjoying the course. So the first year or the first semester, because her mind was that, oh, I wanted to do medicine, she actually did very, very badly in the first 2 years. And in that case, it means it affects you in your final degree. So what Emma is saying, that you have to try to enjoy what you're doing. If you come to do, whether it's biomedical science or it's clinical pharmacology, you want to try to enjoy it. After you have got your degree, you can think about what you want to do next. It can be medicine, or you may even decide that you want to go on to work in an industry. So it's very important you enjoy what you are doing while you are here.
Thank you. And a question for Ikari, how do you find the workload?
So I thought in first year, in comparison to A-levels, it was kind of all right. But now that I'm in my second year, I don't know if I can say exactly the same. I feel like more so than the transition being difficult from A-levels to first year, I think it's more difficult transitioning from first year to second year, just because it's just, the content is just more dense and you kind of just have to stay on top of it. And as Professor Baker often tells us, we should just try to stay ahead. And that's how I've been attempting to do, and it's worked out for me quite well thus far. Oh, but you do have sorry, just to add, you do have a free day on Wednesday, and that's where I usually just do all my notes, and just if I fall behind, that's where I catch up.
Okay, perfect, thank you. I hope that answers your question, Afua, if you're still watching with us. And somebody asked, how flexible is it to switch between similar courses after the first year? So at St. George's, there is no switching between courses. You apply to start from the first year of any of our programs. So for example, if you apply to start biomedical science in year 2, you can't now switch to clinical pharmacology or paramedic science. You have to meet the requirements and to study any of our courses, and you will start from year 1. So there is no switching between the programs, okay? And then we have another question here. Just bring that down. Can you get a place in biomedical science even if you don't do biology at A level? I'll leave that one with you, Dr. Young.
No, that's no. You can't get an offer in biomedical science if you haven't done biology. That's what in the entry criteria says. You have to have biology and chemistry. It's not one or the other. So for the biomedical degree in St. George's, you need to get A and 2 Bs, and then either biology and chemistry to a B in biology or chemistry. So the two of them you'll need both of them, biology and chemistry.
Okay.
You can come to ClinPharm with just chemistry, but or just biology, but you can't do biomed with one. You have to have both for biomed. Having said that, biology is incredibly useful, I think, for any science degree, and I think people who've done ClinPharm without biology have found it harder.
Okay, thank you for that insight, Emma and Dr. Yao. And we had a few questions, people asking if they could get into biomedical science without applying for it, or how likely is it that they could get into biomedical science if they've been rejected for medicine. And I guess some of these questions have come from those that have been rejected for medicine because their UK CAT score is low. So I might have said this at the beginning, but I will just say this again. So I know that there are some people that are watching that applied for medicine, but they didn't, they were rejected because their UK CAT scores are too low. So you probably had an email from admissions saying that your applications could be considered for biomedical science and clinical pharmacology. So if you guys are watching, I guess in that type of circumstance, the admissions can consider your applications for biomed and clinical pharmacology, although you didn't directly apply for those courses. So if that's what those questions were related to, then if you are one of those students, then technically, yes, in that circumstance, you technically don't have to apply for it or didn't apply for it in the application cycle to be considered for it. So I hope that did answer those questions. Otherwise, if you haven't applied for those courses, you can still apply now because the application deadline is the 15th of January. So if you haven't applied for it yet and you still have a UCAS application space to apply for ClinPharm or biomedical science, then please do so through UCAS by the 15th of January deadline. Okay. Somebody asked a question, what does the daily life of a clinical pharmacologist look like? And I think they were wanting to know about how much time they might spend in labs, or how clinical would the daily life look like for a clinical pharmacologist.
Is this a working clinical pharmacologist or a student?
They didn't specify, but I would, I think they might mean working, or it could be student. Maybe we can tackle both.
So should we do both?
Yeah.
Very quickly, I think for a clinical pharmacologist, again, as I said, at the end of the degree, there's lots of different pathways you could go into. So let's say you're working in clinical trials. The sorts of things you might do would include writing things, so writing protocols and research documents and reviewing research documents, so sometime at a desk. If you are doing clinical trials, you might work in a clinical trials unit, so that might be customer facing, on your feet, recruiting patients. You might be in a lab analyzing and processing samples. You might be working in, for example, regulation, where you're looking at documents, you're going to meetings, meeting different people, networking. Pharmaceutical companies are all over the world, so once the COVID pandemic is settled, lots of opportunities to travel and work abroad. I think that each of those roles will have its own individual daily, own sort of working week. But for example, if you do a graduate program in a pharmaceutical company, you usually rotate through all those different roles, so you can see how different departments work and which area is interesting to you. I'll hand over to Ikari.
So a week as a ClinPharm student, so on Monday in first year we had tutorial or hub and clinical skills or practicals, depends on the week. And Tuesday would be mainly lecture. It is our day off, thankfully. Thursday is data and stats, and Friday is special because there's DBL or drug-based learning. But there is some room to do other things, so have other commitments, like if you want to work or join a society, you have more than enough free time to do so.
Thank you. We've just got time for 1 or 2 more questions. So what I will say is any questions that have not been responded to during this webinar, you will receive an email with the response to those final few questions within the next few days, okay? So let's see what we have time for here. How many people approximately apply for the transfer to medicine?
If I may say that, if the students want to talk, or should I say, I think this year we had a lot of students applying for, because it depends on the number of students that get 66% or above. This year, for some reason, I don't know, is it because the exams were taken remotely? So we had a lot of students. So Dania, I'm so sorry that maybe you didn't get through, because there were too many students that got for the interview, but normally it's between 60, 70, average about 70 students that get to apply for the transfer. Maximum that I've seen is about 85 students. That was about, I think, about 3 or 4 years ago. But this year, a lot of students got into the interview.
Okay, and then you said there's about 25 places for the transfer?
Yeah, 25 places for the transfer, yeah.
Okay, great. Thank you for that. And our last question now, let's see who that lucky person will be. As a year 12 student, how do I get free work experience that will help my personal statement? This is a question from Ali. So if you're still with us, we'll answer that for you now. I guess we've put this over to our students. How were you guys able to get any work experience?
I mean, unless anybody else wants to go for it, I don't mind. But
go on, Dania.
Yeah. So it's really difficult. I think especially now with COVID, it's very difficult to get any experience in terms of healthcare work. But there's this really good resource which a lot of people have used. It's the Brighton and Sussex Medical School virtual experience, which I think Georges actually recommends. So that's one you can do online completely at home, and you get a certificate for it as well. There's also an observed GP, a virtual experience that you can do that's for free as well. Besides that, if you're able to get in the actual environment, I'm assuming this is for like medicine or healthcare related things actually. I would say what I did was I sat one day and I made a list of like 40 different GP surgeries and hospitals and consultant names in the local hospitals and called every single one, emailed every single one. And from there, I got like hospital work experience, like one. It took like a lot of effort. So I think just being consistent and doing your best to contact everybody, any possible avenue available to you, just do your best. And even if it's not specifically science or healthcare related, if you have a part-time job or anything like that, any sort of extra club activities, like charities, local care homes, stuff like that, anything that can sort of show your skills, I'd say go for that. But it doesn't have to be specifically healthcare.
Okay, thank you. And one final question for you, Emma. What is the exam style for clinical pharmacology?
So in the
style, I guess. Yeah.
So again, it depends on the stage of the exams. In the first 18 months, it's a combination of single best answer and short answer questions. Once we get into semester 4, the second year, there's no exams. It's research project, writing up a short report, a research symposium, work experience reports, and then in year 3, it will be more of a short answer format. I hope that makes sense. So short answers where you get asked questions and you get marks for free text writing the answer, and single best answer is choosing one answer from 5.
Perfect. Thank you so much. Thank you so much for your useful information, staff and students, and thank you, audience, for listening. Hope you got a lot of useful information from this. If there are any remaining questions that you have after this webinar has ended, then please do give us a call or an email. You can email study@sgul.ac.uk, and our student recruitment team will be able to get back to you with a response to your question. And I wish you guys all the best of your applications during this current application cycle. Remember, 15th of January is when applications are due in for our healthcare courses. And for those of you that are still with us now, what I'm going to do just to finish off this webinar is I'm going to play a video to give you a bit of a tour of our campus, as you're not able to get down into in there now to have a tour around. So I'm going to show you guys a video. It's about 5 minutes long. And yes, stick around for that. I'm going to play that in just a few moments. Thank you again, staff and students. You guys don't have to stick around to watch this campus tour if you don't wish to, but I thank you guys again for your useful insight into both of those courses.
Good luck, everybody.
Okay, thank you.
Thank
Good
you.
luck. Goodbye, Emma. Goodbye, Anya and Jennifer and Akre.
Thank you.
And
Bye.
then also
Thank you,
Good luck,
everybody.
guys.
Bye.
Bye.
Bye. Bye.
And just remember, any questions that remain unanswered, you will get an email response to those within the next few days. Thank you again. Thank you to those of you that stuck around to watch that. We hope that was insightful for you, and we look forward to your applications and hopefully welcoming you to St. George's in the coming weeks or years. Have a good evening. Bye.